Heading overseas now, where in Russia there is a startling difference between how some of their healthcare workers are being treated right now. While many Americans and Western nations have been cheering on our doctors, nurses, and medical workers, expressing our gratitude for their risky, grueling work treating COVID patients, there are health professionals in Russia who are facing immense pressure not to speak up about the challenges they're facing. It comes as the country is experiencing a crush of cases, and while President Putin makes his latest power grab. Our Patrick Reevell reports.
Scenes of victory. Vladimir Putin on Wednesday presiding over a huge military parade. Thousands of troops, not much social distancing. It was to mark the 75th anniversary of Russia's victory in World War II. And from how it looked, you might think Russia has also defeated the coronavirus. But with cases still growing nationally by around 7,000 a day, that's not the reality. And this week, politics takes center stage in Russia. People are voting on a referendum to change the country's constitution to allow Putin to remain in power until 2036. Temperatures being checked at polling stations, the vote spread out over 7 days to allow for more time to get to the polls. The Kremlin has rushed ahead with the vote as soon as Moscow's virus epidemic started to ease. But in reality, outside the capital, in many parts of Russia, it's only now accelerating.
Help me. I want to live. I'm going to die in this bed.
Irina Sukhanova is a mother of triplets. In late May, she fell sick with COVID-19 in the northern city of Severodvinsk. She says hospitals were already so full that ambulances 4 times refused to take her because there were no beds.
When I arrived, I didn't think that around our hospital there would be a whole line of ambulances, people just standing on the street so that they can get into the hospital.
On her floor, she says there were just 2 nurses and 1 doctor for 57 patients. The other staff already infected.
They're working several shifts. They're tired, they're dropping. It's sad for me to look at them. I'm really sorry for them. Moscow, St. Petersburg, big cities, there everything's a lot easier. But small cities suffer. There everything is okay. It's like we live by ourselves.
Similar stories have played out across Russia. The country has recorded over 600,000 cases, the 3rd most in the world. Moscow's health system has coped relatively well, but with far fewer resources, regional hospitals are struggling to manage. Ambulances having to queue for hours, in some regions the military having to be sent in. And throughout, there's been a severe shortage of protective gear. Health workers across the country making video appeals for PPE. At least 500 medical workers have died, according to Russia's health ministry, the shortages posing a mortal danger. But speaking up about problems in Russia isn't something that's encouraged.
We don't have hazmat suits. We don't have respirators and N95s. We don't have screens. We don't have goggles. We don't have antiseptic for our hands.
Tatiana Reva, an ICU medic in the southern Volgograd region, posted a video in March that her hospital had no PPE. She says her bosses tried to fire her. Then she was summoned by police.
The pressure started immediately after I spoke out.
After her post, she says the hospital bought PPE, but she fears police will still now try to charge her with spreading fake information about the epidemic. Criminal prosecution of medics has been rare, but across Russia, many have reported threats of being fired for speaking out.
The pressure is great, really, from the officials, from the chief doctors, because, of course, there was an order from the government, from Putin, that in Russia must be everything okay. So they should be silent.
We interviewed Dr. Anastasia Vasilyeva at the start of Russia's epidemic.
The situation is awful, really. They are sewing the masks themselves. They have no masks, no respirators, no glasses, so no costumes to protect them. The situation is terrible all across Russia.
A fierce critic of Vladimir Putin, she heads a medical union, and for months her organization and others have helped supply PPE to doctors and draw attention to trouble spots. The situation with PPE has improved, though she says requests for donations are still coming in. In April, she was arrested during a delivery.
In what hospital was Putin? He was in the best hospital, one best hospital in the whole Russia. If he just, he can travel to real hospitals, to real hospital to see, to look after the real situation, but he really didn't do it. He's sitting in his bunker and making his ambitions to come true.
With authorities encouraging people to vote, she and other critics fear another surge of infections. If there is, they say it will be health workers who have to shoulder the cost of the Kremlin's ambitions. Patrick Reevell, ABC News, Dublin.
Our thanks to Patrick.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.